Hello and namaskar everyone. I'm Divya, your host, and welcome to today's live session. Thank you for joining our live session. In today's session, we have Dr. Sobha Sunderrajan. She started with general practice with Grand Hospital and finished with family practice at Swedish Covenant Hospital. Then she moved to Missouri, did internal medicine and nephrology fellowship. She worked in the faculty at the university and moved to California in 1986. Since has been in private practice. In 2020, COVID hit the world. She became full-time yoga teacher and heartfulness meditation trainer. So without any delay, let's welcome Dr. Sobha. How are you, ma'am?
I'm doing good, Divya. Thank you for giving me this opportunity and eGlobalDoctors.com doctors for giving me the opportunity to work with them during COVID. And I really enjoyed working with them on the Zoom.
Yeah. If you are just joining our session, we are going to explore about kidney failure symptoms and their treatment. We'll provide information of that with our specialist, Dr. Sobha. What do you say, Doctor? Shall we dive in?
Yes, please. I'm
Okay.
ready.
Yeah. Let's start with the very first question about kidneys. What functions kidney performs?
There are two kidneys in the body, and kidneys are mainly responsible for removing all the waste products the body makes. And it also maintains water fluid balance. It filters about 100 liters of fluid, out of which 98 quarts are returned back to the blood. 2 quarts of waste products are removed as urine. And it also maintains the acid-base balance in the body. Acid produced by the metabolic products is removed. And the third function is it removes all the excess quantities of drugs and toxins that are in the body through the urine.
So, as our topic is kidney failure, my next question is what are the first signs or symptoms of kidney failure?
The first signs and symptoms of kidney failure. Let's look at the symptoms. And they may come in with just feeling tired, feeling nauseated, or not having a good appetite, not able to eat, loss of weight. Or they may have bloating, facial swelling when they wake up in the morning, shortness of breath, heart enlargement, increased blood pressure, swelling of the feet, and so on and off. All these symptoms may come. The symptoms when you see the patient, they may have high blood pressure and they may have diabetes that they didn't know that they have diabetes. And they may have some changes in the eyes, like hemorrhage or changes of diabetes. And they may have heart enlargement and fluid in the lungs and swelling of the legs. These are the main signs that you see when you see a patient.
Okay. So there are many different symptoms.
Yes.
Yeah.
Yes.
So let me remind to our viewers that we are live on FB, Instagram, Twitter, YouTube, LinkedIn. So hop on your favorite social media. We are exploring about kidney failure symptoms and their treatment with Dr. Sobha. So my next question is, Doctor, what are the common causes of kidney failure?
Well, it used to be the uncontrolled blood pressure in the past to be the most common cause of kidney failure. But in the last 10 years, it flipped. Now diabetes is the most common cause of kidney failure. Diabetic became an epidemic in most of the world, and it is the most common cause of kidney failure. And then comes the hypertension and some of the glomerulonephritis, which is inflammation of the kidneys, and some genetic diseases like polycystic kidney disease, IgA nephropathy can also cause kidney failure. And some toxins and some antibiotics used in overdose can also cause kidney failure.
Okay, so that means diabetes and hypertension are the main causes of kidney.
Main cause, yes.
Yeah. Okay. So how do I check if my kidneys are okay or not?
So the most important thing is for everyone to have a regular checkup with their doctors. So the first thing they check when you go to your doctor is, of course, after physical examination, they check your blood pressure. So if you have kidney failure, you may have high blood pressure. And they check your heart and lungs, which may be enlarged and have fluid. They definitely check your urine, and the urine may show protein and blood, suggesting there is a kidney issue. And then they will order lab tests, blood tests, to check at the electrolytes and to check at the kidney function, which there are two tests that are done for the kidney function, which is blood urea nitrogen and creatinine. So they are elevated in the kidney failure. And sometimes you can see elevation of the potassium also in the kidney failure patients.
Okay, that's wonderful. Hopefully, this session will guide our audience in right direction or what needs to be done for their health purposes. Moving to the next question. What organs are affected by kidney?
Kidney affects every organ in the body, every system in the body. Really, kidneys are as important as heart and lungs to maintain the balance in your body. So starting from the head, brain and head, you can have headaches and you can have confusion due to encephalopathy, and you can have, as I mentioned before, eye changes, difficulty in seeing things, blood vision, and nausea and vomiting, and shortness of breath, and heart enlargement. And coming down to the abdominal area, you can have gastritis because of the toxins that build up when your kidneys don't function. Your stomach gets irritated and you can have gastritis. And you can have fluid buildup in the stomach also, just like you have fluid buildup in the extremities, in the legs. So people come with swollen legs, not knowing that their kidneys are not functioning. So these are some of the things that we see on examination. And these are the areas that are affected most commonly that you obviously can see and patient can recognize it.
Okay, that means all the organs are affected by kidney.
Yes, yes.
So, viewers, eGlobalDoctors is one complete healthcare platform solution for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living. Dr. Shobha, how common is kidney failure?
How common is kidney failure? About 780,000 people in US are with end-stage renal disease. That means their kidneys don't work and they're waiting for treatment. 71% are on dialysis and 28% have the transplant. And women to men ratio is 2 to 3. That means men are more affected than women. And more blacks are affected than the whites. More Hispanics are affected than the whites. And that is the incidence for end-stage renal disease when the kidneys really fail.
So, viewers, eGlobalDoctors has started a new diet consultation as nutrition and health. Our holistic nutrition coaches will help you to reverse the chronic diseases and you will live a healthy life. Go to eglobaldoctors.com and check the details. Dr. Shubha, how long is life after kidney failure?
Well, usually if you don't have underlying diseases which increases the mortality like diabetes and hypertension, if they are on dialysis, it could be 5 to 10 years. And it also depends on the age of the patient. The older they are, the less number of years they survive. Again, you have to take into consideration the factors that affect the mortality is the age, the diabetes, the hypertension, and whether they are getting treatment adequately or not. So 5 to 10 years. And if they have a transplant by luck, then they can live longer. And especially if they are younger age group.
So how is kidney failure? Like, what are the treatment options for kidney failure?
So the treatment options, right? There are 4 stages of kidney failure: mild, first stage, second stage, third stage, fourth stage, depending on your kidney function. They divide it into 4 stages. In the first 2 stages of kidney failure, it's more medical management of controlling the hypertension, diabetes, their weight, and healthy lifestyle habits like sleeping good, eating good, and having stress reduction in their lifestyle. The last stage, 4th stage, which is when your kidney function is less than 10% or less than 15%, that's when you recommend dialysis treatment or transplantation. Those are the 2 options when the kidney cannot function more than 15% of the normal.
Okay. So as you are talking about the diabetes, like it's the main cause of kidney failure. eGlobalDoctor is providing the nutritional coaching for diabetes remission. So you can join the program. 3 weeks and 3 months plans are available. So, doctor, as we talked about the symptoms, causes, and treatment options for kidney failure, I want to ask one more question. Can a person recover from kidney failure?
Sure, if it is acute kidney failure, we call it, when it is secondary to acute illness or secondary to medications or secondary to some injury like a contrast dye, if they injected and your kidneys are not working well, you can go into acute kidney failure. That time, supporting with dialysis and other treatments, they can recover from kidney failure. Usually we tell them that 3 months is the time we watch for them to recover. Some people recover even after 6 months.
That means people can recover from kidney failure
if it is an acute incident.
Yeah. Okay. So, viewers, if you're Indian origin living in US or your parents are flying from India to US, you do not need to worry about the medical. eGlobalDoctors has it. We have different packages for you, starting from $199, which will give access to 350 plus doctors with 40 plus specialties. We have also launched cancer care on our platform. Through cancer care, we are providing second medical opinion for cancer with expert doctors like Dr. Sobha. And these doctors are from USA, UK, India, Australia, and Canada. Now you can book your appointment for you or your loved ones. Visit eglobaldoctors.com for more details. Dr. Shobha, is there a way we prevent kidney failure?
Yeah, first of all, I didn't mention the various treatments that are available for kidney failure. We just talked about the stages. Yeah. So once the patient is in kidney failure, there are options of dialysis and transplantation. Dialysis could be hemodialysis, which is done through your veins in the arm. So the blood is taken out and run into a machine, cleaned and given back to you. Or it could be done through putting a needle in the stomach, catheter in the stomach area, whereas high concentration of glucose solution is installed into the abdomen, free cavity, and then it stays there for 4 hours. And then it exchanges with the blood and all the toxins are removed into that fluid and it is drained out, removing all the toxins. Then another bottle of fluid is installed, so and so forth. So in peritoneal dialysis, 4 to 5 exchanges per day are done, 24 hours a day. And patient does it at home. Whereas hemodialysis is done in a medical outpatient office 3 times a week, 4 to 5 hours or 3 to 5 hours, depending on the patient's condition, their weight, height, and etc. And this hemodialysis can also be done at home. They teach the patient and the partner how to do the hemodialysis at home, and they will provide the machine, and the Medicare covers all these treatments. And the last one is transplantation. Transplantation could be either cadaveric or family related, blood related. So if you have a family member that blood is same as yours, it could be taken from a family member and transplanted. Otherwise, you have to wait for a cadaveric kidney to be available of your group, blood group, to be transplanted to you. So these are the options for renal dialysis patient. And your question, next question, sorry.
Yeah. So, Manik, we have one question on FB. Can I identify kidney failure at home?
If you have all these symptoms, and if you check your urine with what they call dipstick, means the dipstick is available in the pharmacies. If you dip that paper in your urine, it may show protein in blood, then you know that you have to go to the doctor. Or you have the symptoms of not feeling well, nausea, vomiting, other things, you go to the doctor.
Okay, so we can check the
urine at home.
Kidney. Yeah, okay. That's great. So my last question is, what foods help repair kidneys?
Well, so as far as nutrition is concerned, if you have diabetic, of course, you have to be on a diabetic diet. And if you have kidney failure, you have to be on a low salt, fluid restricted diet. And also if you are in the early stages of kidney failure, you have to restrict your protein in the diet, because the protein waste products have to be excreted by the kidneys. So if you eat too much protein, the kidney gets stressed out and the kidney function gets worse easily. So to prescribe a diet for these people is not so easy. Knowing that so many cultures and so many foods are available, I think they definitely need a consultation with a dietitian and a nutritionist. And usually here in America, we have a dietitian working with dialysis patients separately. And if you add an Indian diet to a diabetic diet and a kidney failure patient diet, it's pretty complicated.
That's good to know about that. So, Dr. Sobha, any words for our viewers for watching?
Yeah, I would suggest that everybody to get regular checkups and try to have a healthy lifestyle, maintaining a well-balanced diet and keeping their weight under control, getting physical exercise, sleeping well, and decreasing the stress in their life by doing whatever they like to do, music, dance, or meditation, or yoga, or Tai Chi, or anything that they like that will decrease the stress. And controlling the hypertension and diabetes is very, very, very important to prevent kidney failure.
Okay, so we need to focus on diabetes and hypertension to control the kidney. Yeah, you were saying.
And I really thank all of you, all the volunteers and the eGlobalDoctors for giving me this chance to address the common symptoms and signs of kidney failure. And I'm available, as you said, for any consultation on this site.
Yeah. So viewers, we have variety of featured categories as diabetes, remission, detox program, weight loss, child nutrition, gut health, menopause nutrition support, and reversal of PCOS. You can register with us today at eglobaldoctors.com and book your appointment to get a proper nutrition coaching. Thank you, Dr. Sobha, for providing such useful information about the kidney failure symptoms and their treatments. Viewers, you can connect to Dr. Sobha for any health queries on eGlobalDoctors. Thank you for joining the session. So it's a wrap.
Thank you.